don't even bother.
I'm really excited that no, I'm really not though. I'm partially excited that we have rain.
Oh.
But I'm not actually excited.
Are you like a sunny weather?
No, I want to be at home in the rain.
Oh, like a home reading a book, drinking a cup of tea.
Mm-hmm.
Yeah. But we need this rain so bad.
Oh, thank you. We do. I know.
Oof.
We do.
It's been a very concerning. Are you guys skiers at all?
No, but from California, knowing fire season, I'm more worried.
That's the bigger issue. Like we can get over it as skiers that it might.
I do feel really bad for the skiers though.
My concern is like the ticks, the mosquitoes. I want a hard freeze.
Yeah,
yeah. Kill all those little suckers.
Yeah,
Gross.
that's a good point too.
I forgot about those.
Ticks, yeah.
Well, on this rainy morning, we are joined by Amber Warren.
Thanks, ladies.
Welcome. Amber is one of the owners and a provider at Functional Medicine Institute here in Idaho's fabulous Treasure Valley. Mm-hmm. And I would love you. Oh, I'm sorry. She's also the host of the Functional Medicine Institute podcast.
Thank you.
Which super interesting. Yeah. And I love that you give little snippets of information and it's so easily digestible.
Oh, good.
So definitely follow along to that one because
functional medicine's so hot right now.
It is so hot right now.
Megan. Yeah.
It is so hot. Yeah. So I would love for you to please share your background, how you came to be in this current situation that you're in and like your role and where you came from and all of that.
Oh my gosh, thank you. Yeah, so I've lived here since I was 4. I was kind of raised in Boise and I love I'm so glad you said the Treasure Valley because I just adore this city. I love raising my family here. I love all that it offers. And I always knew I wanted to go into medicine. And I think I've just always had that passion since I was little. I was like that weird teenager that ate salads and, went for runs and just was always very aware of my body and what I was putting in my body. And I actually wanted to go to medical school up until my 3rd year in college. And I just had a couple mentors come alongside and say are you sure? Being a PA is a really great route to have the best of both worlds. And honestly, I came to know the Lord in college and realized that being a mom and a wife was also going to be a really important part of my life and didn't want to just be consumed by a career. And so kind of landed into going to PA school. And it was one of the best decisions ever. And then it's God just had this crazy plan of my husband and I taking over a medical practice and building a medical practice. And it's just been the coolest journey. So yeah, I started my career in conventional medicine, actually doing orthopedic surgery here downtown. And then eventually 3 or 4 years into it, got married and being on call as cool and as sexy as it was. Not that cool as a mom. I married a man who I had a 4-year-old little boy. And so I became an instant mom. And just knew I needed to change roles. So I actually jumped ship to a clinic that we worked closely with, rheumatology, so dealing with autoimmune disease, and really loved it. I was doing more of the internal medicine and comprehensive care that I had learned in school and loved that I was using it. But, we sign a Hippocratic oath as medical providers that says to do no harm. And I'd be lying if I didn't go to work most days and think I'm actually doing harm by just prescribing a pill for an ill and just getting through my clients as quickly as I could to meet a quota and not being able to truly, it kind of became a joke between me and my nurse that oh my gosh, she wants to talk to you about the dietary changes that, Mrs. Smith has made. And I was like, yes, okay, I'll spend a few extra minutes, but don't let me get too far behind because that was my passion. I knew that, the way your mind works and what you put into your body and the environment you expose yourself, it is dramatically impactful to your health. And I noticed the more I spent extra time educating my clients on things like nutrition and movement and stress management, their medication list started to shrink and their symptoms got better without needing as many meds. And so it kind of just fueled my fire to say what's next for me. I started a family and just knew, God was just pulling at my heart, knowing I needed to make a change. And there was a small functional medicine clinic actually really close to where we are off of Hill Road. And I called and they had an opening and said, when can you start? And I was like, whoa, this is a big jump for me. And so I started working in functional medicine and just kind of learned the ropes as I went and had a great mentor, Dr. Gail Eberharder, that owned the clinic at the time. And our story is actually pretty wild and I don't want to spend too much time, but about honestly, a few months into me starting to work at this small functional medicine clinic, my husband raced mountain bikes, downhill mountain biking professionally, and he had multiple different concussions. And he had one really bad one right when we started our family. I think I had, oh my gosh, I think the first concussion, I had just had a baby. And when I went to pick him up, our friend found him unconscious on a trail. and he didn't know who our baby was. And yeah, so that was, and he grew up playing football and actually got hit by a car when he was 5 and was in the ICU. So lots of head trauma. And it was my functional medicine mentor that truly saved his life. He was dealing with chronic headaches, chronic pain, depression. He was starting to have suicidal ideation. And I said, babe, you need functional medicine. Like, this is the only, I had him here at the concussion clinic downtown at St. Luke's, and he just wasn't getting better. And it was truly functional medicine that saved his life. And he was within like 3 weeks of, and we already ate pretty well, but dramatically changed his diet, supplement protocols, brain rest. He was 80% better. Like, it was magical. And so he became a believer. I think my point to this story is he was a little bit, when I started to shift my career path and wanted to go more towards holistic medicine, he's like, oh, you're already so hard on us. Like, I want my pizza, I want my beer, I want to have fun. Like, I want to live in, ignorance. And so he wasn't crazy supportive of me making this shift. And I took a pay cut and benefits changed and all the things, but then he became a believer. And so it was actually really cool. The doc that owned the clinic at the time approached us and said, I want to retire early. I want to move to the mountains. Will you guys take over this clinic? And so we went from, I think there were 7 of us in this small little clinic downtown, and now we've got 3 locations with like 115 employees. Like, it's just been crazy what God's done, and
that's cool.
The growth of the Treasure. It's not just it's definitely not us. It's the growth of the Treasure Valley, the demand for functional medicine. I think COVID, we can talk about that. What COVID did for just kind of eyes wide open and people asking all the right questions and like being advocates of their health, their healthcare journey. So. Yeah, that's
a wild
quick and dirty story. Yeah, it's pretty cool. It's fun. I haven't shared that full story for a while. So
I was gonna say, I love that sometimes people who are non-believers, I don't love that they have to have an event like that,
right.
But I do love that they eventually, what they get out of it is full healing in a different direction. Because, and we talked about, and she knows, I've had a 30-year lupus history.
You've shared that
so.
with me,
For me now, in my 13th year of remission off drugs is a huge thing, but I attribute that all to being, I was in a flare that nothing would get better and my kidney function just kept decreasing all the time. And, none of the medicines, like nothing was helping me, but throwing myself into fitness, really cleaning up what I ate. And then I have a lot of faith. So it was all of those steps that I think propelled me here. I still have things that happen all the time because that's autoimmune.
Right.
But in terms of the overall disease, it's stable where it is. Like, we're okay for now. I'm
Praise
like,
God
thank
for
God.
that, yeah.
Yes. I'm so happy and so grateful for that. But it is just amazing to hear the story. And I do think that we are in a society, especially since COVID, that we want this. People are yearning for this. They've been asking for this. And when you have even childhood obesity, this is too much. It
gets pretty wild.
It needs to change. Like, there need to be big changes. So I love that people are being proactive with it.
Yeah, and I tell a lot of my autoimmune clients, because that's my background, right, is working in the rheumatology clinic, and that's truly how I came to want to do root cause medicine, is because I'm like, gosh, I can't just keep putting Band-Aids on your symptoms and then watch you need an anti-nausea pill or a pain pill for your headaches because the medication is causing that. Like, 80% of your immune system lives, this, in your gut. It's your gut microbiome. That's the majority of our immune system, right? So and that's where functional medicine shines, is truly with gut health and recognizing that. And I tell my autoimmune patients, this is my point, going forward, you're healed, you're in remission, that's amazing, but you're always going to have to color in between the lines.
Sure.
You're probably not going to have that freedom to just go on a binge or to Vegas for 2 weeks and just live the life you want to live that maybe other ones of us could get away with. So yeah, but that's amazing. I'm so happy for you. That's really cool.
I always say whenever I have a weird thing that comes up, it's always, well, that's just courtesy of being autoimmune. Yeah. So I do tend to live as clean as I can with what I eat and just kind of the lifestyle. But I know that, I'm human. I don't get enough sleep. I overstress and my disease is triggered by stress.
Yep.
So these are all things that you have to take the active approach for. And I try as best as I can, but it's still just, I know I'm with it for life and that's fine. But I mitigate where I can, even though I could do better. We all can.
We all can. And there's no one that lives. And I think if you're trying to aim for 100%, you're just going to continue to feel like a failure, right? I think it should be more 90-10. My husband's like, 80-20. And, because it is. None of us are meant to live on this earth forever. And when you live with such a strict lifestyle like that really zaps the joy out of it. And there's actually a ton of studies that have been done on people that, just like as an example, like if I'm not going to go out to dinner with girlfriends or go to dinner with family friends because I don't want to eat that food or I don't want to drink wine or I'm never going to like engage and break bread with people, like that could be more detrimental to my health than like living in community, because we're we're designed to live in community. And so it's always just walking that fine line. And I had to learn that early in my career when I came out like guns ablaze and hardcore, like you have to eat perfectly. Let's dial in your sleep. Let's get your hormones. And it's like, oh, that can be really overwhelming for people, for my clients who this is a very new world for them. You know, a lot of people are walking around like not even aware of their body signals, not even aware of what their body's giving them, right? So my job is to meet my clients where they're at. It's not a hierarchy. It's not me talking down to my client. I even had a client yesterday that was like, you're going to be so mad at me. I had a horrible Christmas. I got sick and I'm still not exercising. And I'm like, mad at you? Like, this is the psyche we have to reverse in these people, right? I still sleep at night if your labs don't look great and you're not exercising, right? My job is to be your cheerleader and in some aspect your accountability partner and to guide you along in this healthcare journey. Let's get rid of that idea that my job is to stand above you and talk down to you and tell you what you know. My job is to meet you where you need to be met, because there's no relationship that works well if someone's always just domineering and telling someone what to do, right? And that's the issue with healthcare. I mean, there's a lot of issues with a conventional approach in medicine nowadays, but that's one of the issues I see is with these doctor-patient relationships.
It's a control. It's also a power thing. We always talk about power.
Yeah.
But getting sick at 13, all you do with a single mom, all you do is put trust in the doctors. So I had the most aggressive care when I was 13 from these doctors at Children's Hospital in San Diego. World-renowned doctors, but God complex doctors also. That if you're going to steer off the path at all, I mean, my mom got accused of, you're killing your daughter, you're going to let her die, so many times, because if I wanted to take natural things, like if I wanted to take herbs and supplements, or I went through a period in the beginning of the most recent flare, thank God for me, was in 2009, and I haven't had one since that bad. That was horrific, and I stopped all kind of normal, traditional, conventional treatment to work with a DO.
Cool.
And he at least provided me so much relief. I mean, I went through pneumonia at home really bad, and I remember him coming, and it's all the touching and it's like the magic. But great human. I attribute a lot of my healing to going outside the box and really being the advocate for myself. So I always tell people, you're your best advocate. You have to be, and make sure that you're aligning with providers who are giving you that space to do that. There is a reason that I don't get sick off of food in Italy, and I can take down a pastry shop.
Isn't that wild?
And then I come back thinner, and it's like a twofer. It's such a win.
Yeah, we really need to wake up here in America.
I love that it's starting, though.
It is. And the current administration is by no means perfect, but goodness gracious, they're making the right strides towards the awareness and talking about childhood obesity epidemic. Like, that is as far as I'm concerned, RFK and then the head of the FDA, like, that is one of their biggest concerns is our children. And that should be, and it should have been 10 years ago, but I'm just thankful we're there.
Yeah.
Yeah.
Well, and I think, just talking about the awareness of what foods do to you. And like, we eat pretty clean at our house. We're very no seed oil, blah, blah, blah.
Good.
But then, like, if you're at a birthday party, eat the cupcake. I don't care. Like, I'm not psychotic about it, because you have to give yourself grace. And, but I talk to my kids a lot about what we're eating.
Yeah.
And my younger one at a party the other night said, "What does blue do to you again?" And I said, "I think it makes you sad. Are you feeling sad?" And she was like, "Yeah."
And that's great awareness.
And she was like,
you're teaching her to pay attention to her body.
Yeah. And it was like, so if you're going to eat the blue, they were like color changing Oreos, which horrified me.
Wait,
and I
that's a
love
thing?
Oreos. But yeah, I was like, I don't even want to think about how they made those. But she went, "Oh, okay, well, as long as I know that that's all it is."
Yeah.
And I'm not really sad. It's just the Oreos.
That's great.
And I was like, yes.
Yeah.
Perfect. I was
That was a win.
gonna chime in about Oreos. Like, we do tend to eat pretty clean, but when we get blood, we're definitely having those Oreos. We earn those Oreos. You lost so many calories anyway. It's just balance in life. I feel I like the balance in life, but
I think that's key.
I kind of like your 90-10. So I know I get your husband where he's coming from, because all of the things, but a 90-10 approach is pretty good. And then when you're on vacation, not that you do what you want, but you get to make choices. And I mean, everything in Italy, though, is so clean. I was eating veal for like €9, which I'm like, oh, I miss that now. But it's clean. And that was from, the guy who opened the restaurant. It was on his farm. These are his animals. This is Europe, most of Europe, I'd say. Not all of it, but Italy for sure.
Yeah, that's
especially
amazing.
in the southern Italy. So those are good things.
Yeah.
I love the food. I love food conversation, though, because I think it's a tool. There was a smoothie place, like a juice place where I used to live, and they always had one of those chalkboard signs, the A-frames.
Yeah.
And it said food is either the best medicine or the biggest poison. And that's so true.
There's really, and I say that all the time, there's really not a lot of gray. And that's what I teach my kids too, as well. Like your kids are, competitive athletes. And so I'm teaching my boys, if you want to perform well and think well, like you have to pay attention to what you're putting into your body.
Yep.
And food is fuel, and it is meant to be enjoyed, but it always is sending a message to our body. And we just have to be a little bit more aware of that. And I think people also underestimate how good healthy food can taste. It just takes more effort. And that's the biggest issue. We're in a society where we don't have a lot of extra free time. And it's a lot to get into the kitchen and make things from scratch. I get that.
And it's a lot to read all the ingredients.
Oh, it's exhausting.
And people have seen me at the grocery store going, no, put that back.
Yeah.
And I've had people be like, I see you.
Yeah.
But I tell the girls that if God made it in that form, good to go. Have as much of it as you want.
Food without labels.
Yeah.
It's the best way to eat.
Because I recently listened to your episode about maha and food, and it was like, yeah, buddy. And you're talking about paleo, and I don't have this discipline to do. My husband does carnivore off and on, and I don't have the discipline for any of that.
Yeah.
Because if
a lot of that can be a little too restrictive long term.
I have a rager of a sweet tooth, so I have to give myself the grace knowing that it's a journey.
Yeah.
to wean down the sugar. But if God made it, then have as much of it as you want.
Comes from the ground.
And then
God's
just being aware that if I binge on too much processed food, I'm going to feel like garbage the next day.
And guess what? The next day you're also going to find forgiveness for yourself and move on.
Yeah.
And not
because I don't have time to go into a spiral over that.
Over a couple of days of bad eating.
Yeah.
There is something beautiful though about when you become really in tune with your body. So I used to, I competed when I was going through this whole stop all my medicine protocol, and I was working, my kidney doctor, my nephrologist told me there's no other poison to put you on. He told me that, and I credit him for so much because his wife was really into all of the natural stuff. They have a daughter with Down syndrome, so she was always trying to do more of a functional, holistic approach. And so he told me, you just do what you want. Go take your seeds and weeds and do whatever you need to do. But he monitored me, so I never abandoned my medical team for that. I mean, that was a bad flare. So he watched me, but the kidney function, I did another round of chemo. I had done so many things that they were just watching it tank. And so to be able to stop it and now everything's good, there's something about when I was competing and I would be able to get on the scale in the morning and know what I weighed. But that's because everything is so structured and so measured. But then it became the point of, and I think this is probably due to chemo because I've done quite a few rounds of it. There came a point where certain things that always were good for me, all of a sudden made me sick. So I would eat them. And I like routine.
I feel like you still go through that.
Oh, I do. I do all the time. But certain things, I would eat the same thing every day, especially when I was competing 6 times a day. Up to competition, now you're throwing in sweet potatoes an extra 4. So you're eating 10 times a day. But you know your body. It's a machine, and you're just feeding it everything was for performance. Everything was for just longevity of what I was doing and for health. It came to the point where I couldn't eat sweet potatoes anymore. And then I couldn't eat this and I couldn't eat that. And I realized that I feel the best. In 2017, I tried a keto diet.
Yeah.
Felt great.
The best.
I will go in and out of that now because like her, I also have quite a bit of a sweet tooth, but I want dark chocolate, or if I'm feeling really naughty, I'm I want just a little bit of Nutella. So, but I brought that back from Italy in single serve packs so I could have it. And it's different, the one that's manufactured in Italy.
I was going to say, but the Italian Nutella doesn't have a bunch of palm oil in it.
No,
Totally.
it doesn't.
Or high fructose
so
corn syrup.
it's very different.
Yeah.
But
do you know why that was? Not to interrupt you, but
No,
do you
you're
know why
fine.
that was? Your body started to all of a sudden react to sweet potatoes?
Why?
Leaky gut,
Oh.
right? So again, 80% of our immune system lives here. So when if we, it's pretty wild. If we were to lay out our small intestine, it's like the size of a tennis court, right? And we need that because that's where we absorb nutrients.
It's crazy.
But it's really, really thin because we need to maximize absorption. But because it's so thin, it's very susceptible to damage. And so we talk about, pesticides and high fructose corn syrup and antibiotics and too many medications and fillers and stress. Those are all things that'll come along and damage that really thin intestinal tract. And so all of a sudden we start to see what should have been tight junctions that should only allow our nutrients to passively absorb, all of a sudden we've got gap junction. Think of it as little tears in our intestinal tract. And all of a sudden there's food particles getting into those holes, into your bloodstream, activating the immune system. Our immune system works beautifully, right? We create all these antibodies when there's a foreign invader that shouldn't be there. So we can attack it, fight it off and go away, and then recognize it next time. So you most likely, I could be wrong, had tiny little chunks of food particles, sweet potatoes, getting into your immune system, and your immune system sent the troops and started to activate a response like it should, like it was designed to do. So healthy food was all of a sudden being attacked, and your body was mounting an immune response to a healthy food. Not the food's problem, it was your gut. Because you had an autoimmune disease, you had leaky gut, and that was part of the issue. So there's something in your history before you were 13 that caused you to have leaky gut, whether that's trauma, stress. There's genetics that absolutely play a role. Again, toxins, different types of viral infections.
I was highly antibioticized. Is that a word? Let's make it one. Is it?
Yep. It's well, no, but I like it. We can make it one. I've never heard of it. It doesn't mean it's not a word.
Antibioticized.
Antibioticized.
It's pretty clear. So
I like it. So my mom said when I was little, I was on a lot of antibiotics.
Okay.
Like little.
That's probably one of your main, what we call an antecedent or trigger. And that's what we do in functional medicine. We're always trying to back up and say, tell me more about when you got sick or what happened that 6 to 12 months. And it's almost always a perfect storm in this continuum of I was born C-section, not vaginally. I didn't get that inoculation of that good gut bacteria from mom. I was born in a very sterile environment, had a ton of vaccines as a little kid, if I'm allowed to say that word. Fed a ton of antibiotics. So it's really interesting. There's a guy by the name of Dr. Fasano. I think he's either at like Stanford or Yale. He's a pediatric gastroenterologist, and he coined this term like the first 3 years of life. And he kind of actually, he designed the test that we use for leaky gut. It's called a zonulin marker. But his premise is those first 3 years of life set the stage for the rest of your life. And so it's actually pretty wild. Like, again, I'm going to use that binger in Vegas. If we went on a girls' trip to Vegas and just let loose, our gut microbiome could easily reflect back to when we were 3 years old, because that is when it was mostly developed, right, at 3 years old. So we think about these babies that are born in sterile environments, stripped from their mom, not breastfed, trauma, but antibiotics, poor nutrition in general. As a kid, one round of antibiotics and your gut might never recover from that.
Wild.
It's wild.
Wow.
So that's where it's just so much of it, again, goes back to this gut microbiome. We're loaded with these beneficial bacteria that were designed to fight these infections and mount this immune response. But I guarantee that's one of the most significant reasons that you had, the stories I hear, I remember having, because our moms didn't know, right? Our generation, it was always that pink penicillin or amoxicillin, or whatever it was that we were, because they didn't know. The doctors just told them that, right? Ear infection, antibiotic for this, strep throat, antibiotic. And it's almost always I remember eating a lot of Oreos or goldfish as a kid, lots of antibiotics. My parents were big on just making sure I was off to urgent care, off to the pediatrician. And then, I went through a crazy divorce when I was 27 years old, and I was married to an abusive man. And then boom, one morning couldn't wake up. My joints were red hot, swollen. I had this crazy rash head to toe, and my life's never been the same. That type of story is classic.
Wow.
For what we hear.
Yeah.
Mm-hmm. Mm-hmm. And so that's how we unwind it, right? So I know I have to focus on that patient's gut. I know I have to work them through their trauma or stressors, and we have to start calming down the nervous system. I know I have to get them sleeping. And there's a lot of really cool functional tests that we can do. We look at toxins, we look at the gut microbiome, we do micronutrient testing, but some of that's not necessary, right? Because that all adds up and can be really expensive for our clients. And that can be pretty overwhelming too if we start there saying, okay, I want these 5 tests. It's going to be $2,000. And by the way, you got to start sleeping 8 hours a night. Good luck. See you in a month. So we start slow. And again, our job is to meet that client where they need to be met. But there's a lot we can do. I always say I can spend a lot of your money, but we don't always have to start there.
Sure. I did want to ask, just because I wrote some notes because I was curious.
Yeah.
I don't know really how to word this, but which ailments or which type of people are you finding that benefit most from coming from more conventional medicine to functional medicine? Is there one thing? Is it hormone stuff? Is it autoimmune things? Do you find that there's one, I guess, majority type of person? Because I know you see everybody. Yeah, demographic. That was the word I was trying to not use, but we used it. Oh, so no, because someone's going to take it. Someone's going to take it dumb, but it's not. Don't be dumb. It's what demographic of people, I guess, would you say, or that benefit the most, if you even have one?
the question's a little bit hard to ask because I exist in a little bit of a pocket within functional medicine. Like I don't take insurance. I don't do primary care anymore. I used to. I do all specialty cash care. And so my focus is autoimmune disease, metabolic health, weight loss, and hormones. So I don't see kiddos. I don't see a lot of primary care patients. I see a lot of women in our phase of life, to be honest. So it's hard to answer that. I mean, I think everybody could benefit from some aspect of functional medicine, this holistic approach to what we're doing. Someone that's asking, are you... So I will say, though, I think the people that benefit from the most are the people that are coming in, they're completely new and not adverse, but just so new to functional medicine or any kind of integrative holistic care. And they come in and they're exhausted. They don't even know where to start. They're not having a bowel movement every day, right? Like it's just little things like, when I ask somebody and our paperwork says, like we go through digestive complaints and sometimes they won't check constipation. And I always ask, are you having daily bowel movements? And they're like, no. Like I go to the bathroom every 3 days and I'm like, well, that's where we need to start, right? Like that's wild. That is the main pattern of how we detox, right? We poop it out, we pee it out, we sweat it out. And that tells me a lot about their gut microbiome and that we have to start there. So I think my short answer is everyone would benefit from a holistic approach to their care. And again, like we were talking about, becoming more aware of their body. But I think it's those clients that are just so overwhelmed. They don't know where to start. They've been sick for so long. They don't even recognize themselves in their own body, and no one is listening to them. No one is hearing what they say. A perimenopausal woman that's like, I am losing my mind in my home every month, and I can't continue to be this kind of mom and wife. And I can't get myself under control. I think those people that are just at their wits' ends, because it's crazy to see that these little baby steps, they can make a dramatic impact for these clients, right? And like give them their life back and give them help them just bring their best self home. And that's what it's pretty wild. I've said this so many times, like if I only knew what I knew 10 years ago with some of these clients I see, like we have the ability truly, even in hormonal medicine, to save marriages, right? Because the family unit is so important in society. And I could go off on a tangent on this, but like just if we could just get the home environment to be more calm and less anxious and calm down relationships and angst and anxiety and the mental health crisis, like that changes society, right?
Yeah.
Like that changes multiple generations. So anyways, I'll leave it at that.
Well, that's why I started going, was perimenopausal symptoms.
Okay.
And like until you've had a hot flash, you don't know that kind of rage. Like for my 14-year-old self could never. That kind of rage was like unmatched.
And you feel out of control. And it's scary because you're like, I don't know what's going on with my body.
Yeah.
I had a husband-wife come and see me, and the husband's like, I feel bad for her. Like, we don't know how to get this under. Like, I'm sad for her. She's unwell. And I'm like, that is so edifying for your wife to hear you say that.
Yeah.
You're not mad at her because she's acting out of control at home. You are here wanting to get her help, and you feel bad for her. You're sad for her that she's having this like almost out of mind experience because her hormones are out of control.
Yeah. And so every woman I know who's just like raging, I'm like, go to functional med.
Oh,
it'll save your whole life.
Yeah.
And I'm in a Facebook group of mostly women. It's probably 99% women, and it varies in ages a lot.
Yeah.
But the conversations about the parents who divorced when their mom hit 40.
Yes.
And
the
it's
statistics are actually pretty sobering.
Yeah. And it's like, no, my dad was such a good guy, and my mom regrets it to this day. And it was like, now I'm like, I get that.
Oh,
Yeah.
okay.
Because the rage that I have felt in my home against my family was just like shocking.
Yeah.
And it's funny because my functional med is shocked that I don't have gut problems because of
how significant your hormones were. Yeah.
My histamine load's off the charts though.
So like, that's why your hormones are such disaster.
I'm the itchiest person alive. But like everything's better.
Good.
Like things are getting so much better. So I recommend it to everybody because it's just like, it's a game changer.
Yeah. And I know, functional medicine's really good at that, but I would even just say, how about just go to someone that's going to, when you say I'd like my hormone checks, they're actually going to listen to that and actually check your hormones and hear your story.
Yeah.
And be educated on hormones. And that's why I am so thankful for this administration. Like, I don't know if you guys back in November, Marty McKay, the head of the FDA, put out this statement that said, we're now removing the black box warning from all hormone. He didn't say bioidentical. He said hormone replacement therapies, and just went into this. The last 27 years we've done a disservice to women because we were fear-mongering, right? And we weren't practicing good science-based medicine because of some really poorly done studies, Women's Health Initiative being the main one, where we actually were using synthetic hormones on these women. And of course they got cancer. And of course they got blood clots. And of course they had all of these side effects because they were never using innate, natural, bioidentical hormones that our body can recognize. And he said, we've done a disservice. He said, we're taking off the black box warnings. I think he actually said all women need hormones. And as much as I was like, Yahoo about that announcement, because we've been in functional medicine saying that for years, I was also like, but you're still not distinguishing bioidentical versus synthetic hormones, because there's a whole generation of adolescent teenagers and young women that are still on birth control. And that's a synthetic hormone. And that still comes with that side effect profile. And I still think there's this lack of education of what's synthetic and what's bioidentical. And not everyone should just be thrown on hormones, right? There's nuances there. Like you shouldn't be on a transdermal topical estrogen if you still have a uterus without being on a very specific kind of progesterone, because you still need that uterine protection. You don't want to start bleeding again. And if that lasts a long time and your endometrial lining gets thick, you could develop endometrial cancer. So there's definitely nuances. So you want to go to someone that listens to you and go to someone that knows what they're doing and is trained appropriately and is willing to follow you. You don't want to go someone that's just going to slap on hormones and say, call me if you need me, right? You need to be managed. You want to make sure your levels get in an optimal range. And that's in a whole nother conversation. What is an optimal range? Because these reference ranges, when we do lab interpretations on our clients, the reference ranges are actually not based on healthy people. The reference ranges were actually built on hospitalized individuals. Not a lot of people know that, right? So it's why we see these reference ranges. Like, I'll just use this as an example. DHEA is a hormone that our ovaries and our adrenals make that is a precursor to testosterone in men and women. But even by itself, DHEA can impact the immune system beneficially. So someone like you could really benefit if your levels are low. It helps bone health. It helps libido. It helps energy. It can help deep sleep. The reference range is like 42 to like 250, right? Like we've got these wide reference ranges. We like to see it 200 to 250. That's where I like to see my peri and postmenopausal women. And so we're trained to have our own optimal ranges. So it drives me crazy when I see that my clients, go to their wellness provider and get their, metabolic panel, their complete blood count, a lipid panel, hemoglobin A1C, whatever. And they're like, oh, in reference range, looks great. See you next year.
Yeah.
But maybe their hemoglobin A1C went from a 5.2 to a 5.6, and they're now on that border of being a pre-diabetic. That needs to be addressed.
Well, and then they're just going to give them metformin.
And then they're just going to give them metformin when they become a diabetic. And it's like, we could have caught this years before. And then let's not even get into a discussion about the millions of dollars we could have saved in healthcare dollars, right? And the insurances have to start recognizing that preventative care saves them a ton of money. Not that I care about saving them a ton of money,
right?
But then everyone can enjoy lower cost of coverage if we're actually preventing and looking upstream for some of these issues. So yeah, don't get me started. Same with like vitamin D, right? Vitamin D, the reference range is, what is it, like 30 to 80, I think. Well, if you look at the COVID data, a vitamin D of 32, your chances of dying from COVID or ending up hospitalized was significant compared to a level of 60. And I like to see it 60 to 80 year round, right?
Yeah.
It's a pro-hormone. Vitamin D is so important for the immune system and so important for the body. But we're just, 32 looks great because you're within range. No, it's not optimal.
You know what was mind-blowing for me, I think, and this was all after COVID. So after a lot of people, I'd say, woke up throughout the whole COVID thing, listening to people like Gary Brecka, like when I heard the Brigham Bueller on Joe Rogan, and he was saying about, I think everyone always thinks big pharma, but big insurance is even bigger. And that's why functional med exists. Another reason, because they're not going to cover these kinds of tests. They're giving you a very basic baseline. They're not getting into the weeds on the test, which is where the change is that happens in those numbers.
Well, someone like you, that's a difference between like potentially saving your life,
right?
If you're able to get coverage and get someone to really look at your labs in an appropriate way. Anyways, keep going.
No. I was just, it's amazing to me that even when I get my blood and I'm looking at those levels, I think, well, what else is in there though that's missing? Yeah. Or if you ask for hormone, they're not really delving into anything.
Well, and are they having you have that draw on the right day of the month?
Yes, I'm so glad you brought that up. Yeah. because you can't actually look at adequate ratios and adequate numbers, especially of estrogen to progesterone, if you're not looking. And that's where it just comes down to make sure you're seeing somebody that's trained. And there's some fabulous hormone providers out there that aren't trained in functional medicine. So they might not help you with your gut or they might not really help with hormonal balance, but at least they can get some of those hormones replaced and get you feeling better.
Well, and for me, so I was a vet tech for over 10 years and coming from vet med where, there are some specialists, but really a regular DVM is treating that whole patient.
Right.
And then to go to human med is wild to me because you have an ear doctor and you have an eye doctor and you have a teeth doctor and you have a kidney doctor and you have I can see where that stemmed from.
Yeah.
These specialties are great, except that they're so micro-focused on this one body part that they forget that the whole body is a system. And that's what really appeals to me about functional med is that the body is a system. And well, my A1C was high, but nobody ever they just tried to put me on metformin. Nobody ever considered the fact that my cortisol is out of this world.
Which was driving your A1C.
Exactly. And, it's this whole domino effect. No, it's not real metabolic syndrome. It's the stress and the trauma and this whole background. And so to go in and sit down with somebody that's like, where were you born? Like, what?
Yeah.
I'm just having hot flashes and I can't sleep.
Yeah.
And it was so eye-opening, but I appreciate it because the body is a system.
It's funny though, listening to this and how everything really does stem from the gut. You would think, and my experience with my GI here that they put me with, I've had nausea for, I think it's 8 years now. And it just, I have Zofran on deck all the time just because we never know. And I also tend to eat once a day. It works for me. I like it. I'm fine. I can still function and have energy. But this guy basically told me that the nausea was in my head, that I was manifesting it. And I was just thinking, oh my God, they took out my gallbladder during the COVID years. And I mean,
forget you have an internal organ. You don't actually need it. You'll be fine without it.
All the
God made a mistake.
All the chemo,
several.
Right.
Your appendix, your spleen, your gallbladder, your tonsils.
You're
you don't
fine.
need any of those.
You're fine. It might grow back. It might not.
It's fine.
I have no appendix, no gallbladder. So it was just wild to me to hear that from a doctor, especially knowing that so much is dictated and everything is so much is dictated by the gut.
Yeah.
That to hear that from a professional, and that's why I don't really go to him anymore. But it's discouraging. And I think, so I guess I'm going to just circle back to the question that I kind of had struggle getting out because I was trying to figure out how to word it.
You girls didn't answer my question.
No. You did answer it. And it's if you don't feel like you're being listened to.
Yeah.
From whether it's doctors, whether it's what's going on between you and your spouse and your household, all of those things. I think that's crucial to those are the people that are probably finding a lot of relief coming to functional med.
Yeah, they feel heard.
They feel heard.
That's probably one of my favorite things that I hear from my client. Like, thank you for listening.
Yeah.
Or we'll get a Google review that's like, for the first time I felt heard, and it literally brings tears to my eyes because that it's so impactful for people.
Yeah. Well, my gal will say, well, your levels are great, but how do you feel?
Yeah.
Like, that's the point.
Yeah.
What this says on this piece of paper is less important than how you actually feel in your body.
Yeah. We're going to treat the human in front of us. Yeah. The numbers are a guide, but clinically how your body's responding. Because guess what? Not everybody fits in a box.
Yeah.
And that's kind of the beautiful approach to individualized care is that one person might be feeling different with a vitamin D of 50 versus a vitamin D of 80 in someone else. Yeah. So I love that. Yeah. You're going with someone good. That's great. And I think it's, I was just thinking as you were talking, it's this world of just, you have no choice but to be your own advocate in healthcare.
In everything.
And that's yes, Megan, that's kind of my point. But I think that's really what COVID did for us. At least I don't want to speak for everybody, but myself. I am now homeschooling my kids. I think twice about so many different decisions for my family because you just can't trust anybody out there. And it's you have to just kind of approach the world with an eyes wide open. What's best for my family unit and let everything else just bounce off. And so I think that's true in medicine. I think it's true in raising a family. I think it's true in your marriage. I think it's true in business. You continue to do good and have a moral compass where you're going to do the right thing and just trust that other people aren't. And we're all flawed humans. We're all going to make mistakes.
Sure.
But yeah, it's question everything.
Yeah.
Be full of hope. eyes on the Lord, but like question everything.
Yeah.
But yeah, especially in med, I'm out, you have to be your own advocate. And we live in this really interesting world of ChatGPT and having all this information at our fingertips. And I welcome it to a certain extent. I learned so much from my patients. And I think mama bears are some of the most educated, knowledgeable powerhouses out there that are fighting for their child, especially if they have an ill child. But I think it's great when patients are researching and coming in with their questions and questioning the narrative and asking me questions about my approach. Because that's kind of the art of medicine is there always are going to be more than one approach, especially in functional medicine. But yeah, it comes back to like, let's link arms in this journey and get you all together.
Yeah.
And it doesn't always have to be me telling you what to do. Like I'm going to navigate this with you. But yeah. Anyways.
My hope is that more people start going the functional med route.
Yeah.
With the popularity of Gary Brecka and Brigham Bueller and just, all of us women talking to each other, but it's good for men too.
Yep. Good.
But I want more and more people. I want the tide to turn toward that so that the whole insurance pharmaceuticals industry changes.
Yeah. I do. Someone told me this. My husband and I attended a conference where we heard, and I cannot remember his name, but he's like a cardiometabolic cardiologist that turned functional medicine. And he's like, we introduced ourselves as owning functional medicine of Idaho, and he'd heard of us. And he's like, can I just say, like, your specialty clinic, it should not be a specialty clinic. It should not be called functional. It should just be good medicine. Like, it really should be good medicine where patients feel heard. You're looking for the root cause.
Yeah.
And so, yeah, I think about that a lot too. Like, let's stop just calling it like some kind of specialty care.
Yeah. Let's make this the normal thing.
Yeah. Yeah. And I do think, it's pretty wild to hear. I get messages from truly all over the country of people that hear our podcast, practitioners, healthcare practitioners that are like, I'm into this. I've learned a lot from this. Because our goal is to not just educate the community and the average patient. Our goal is to honestly get, people like me that worked in the conventional space that didn't really know what was out there to go work in integrative care. And so I love that I get those messages and I'm like, yeah, keep listening. Come if you want to come shadow, come hang out at our clinic and kind of learn more about what we're doing. So I do think there's absolutely a movement, not just with patients, but with healthcare providers alike. And like, your story about your gastroenterologist, like that makes me sad. I'm sad for him because guess who funds the medical schools? Big pharma. Right? So he didn't have exposure to nutrition. Our nutrition, at least in PA school, like I think I had maybe one 60-minute lecture on nutrition. And it's a joke, right? So they just don't have the training and education, nor the time to spend time with their clients to educate them or feel heard, nor the time or ability to go get trained in functional medicine.
Yeah.
Most big care facilities here in town, I won't name them, they're not actually going to cover CME, continuing medical education funds, to go get integrative or functional training for these providers, even if they wanted it.
No,
they
but
have to get trained in their field.
Farmer reps are going to bring donuts in and goodie bags and
take them to fancy dinners and treat them. And I mean, the whole...
That happens in vet med too.
I'm sure it does.
I was going to say, but that also stems to your hope of hopefully everything kind of the tide shift, because that would then allow for that. I mean, you'd have to either get on board or you're getting out, because if everyone, if the majority of people are gearing towards one way, Callie and Casey Means were another one that when I listened to them, I was like, oh my gosh, because they're were awesome. In it. They were in it and then they left it. So when you hear these experiences, and I remember you telling me about your experience in vet med and me telling you how I have a really good friend in Italy who is a veterinarian, and they do everything so differently for the animals, not for the people, because it's, socialized medicine over there. But those animals, she would tell me it's very holistic from the approach of, what do you mean you guys only have these types of foods there? Here we have every kind of protein you can ever imagine. It's so geared at overall well-being of the animal. And I think, oh my gosh, so it's almost like functional medicine, integrative medicine for animals in Italy, so cool. Which is really cool for me to hear, because I had 2 dogs that I lost, one from kidney disease and one from, she ended up getting lymphoma and having masses all over her liver. And my friend, I mean, I had the vet on deck just because I had one, but my friend coached me and helped me. Okay, you can give her a teaspoon of honey, and if she, then she'll eat something. And don't give them chicken and rice. You give them plain white fish and boiled potatoes, because rice is hard to digest. Most dogs are allergic to chicken. All of these things that I was never taught here by any of the vets that I've ever had my dog see over so many years. So it's just, I like that they take a holistic approach for the animals. Really that cool. was hopeful for me. And then I know that as humans, we can go eat there and never have a problem.
Yeah. Right.
But there was, I'd say maybe it was about 10 years ago when I noticed in Italy the rise in frozen foods, the convenience items now. They've always had cookies and packaged stuff, and it's, you know, it's not great, but it's not what we have here.
Yeah.
So you always had those treats, and they're a mentality that treats it as a treat. Whereas America can sit in front of the TV and annihilate a whole package of cookies or a bag of chips or something. Whereas Italy sees it very much as a treat. But to see the rise of frozen foods for convenience, you also then see the rise of overweight, like obese children. I'm like, gosh, you guys eat pasta every day. How this shouldn't be a thing. It's a wild thing.
Yeah, recognizing the patterns. It is, it's really wild. Yeah. I also think like it just talking again, going back to autoimmune disease and the root cause, I also often take a step back, especially with everything that's going on in the news right now. Our nervous systems were never meant to handle what we're seeing.
Yeah.
Like we were never built to see somebody get murdered on live TV. You know what I mean? Like it's just like this is a wild age we live in where you're constantly being fed the trauma of the world. And that's something that I'm often like, you got to put your screen down. You have to put your phone away. I was reading an article the other day for type 2 diabetics and what just blue light exposure can do to their blood sugar, and avoiding blue light exposure, how that can help control your diabetes and lower your A1C. So it's just like it's so much bigger than just eat well and exercise. It's so much bigger than that. Like what are the messages your body's receiving? There's a really good book called The Body Keeps Score, and it talks about how the body internalizes trauma. And that's another message that I would love to see more healthcare providers having that kind of conversation with their patients, because it is a wild world we live in. And for that same goes back to our children, right?
Yeah.
Our kids are obese, yes, because of the contaminants and the toxins and the fillers and the food dye and the sugar in our food supply, but they're also obese because of the screens and the trauma that they're seeing, and the trauma that they're hearing, right? And that's honestly, it's another reason I homeschooled my kids is I need to know that we can have these dinner conversations at our table and they're not hearing these conversations. Oh, did you hear about, I heard about, they tried to kill President Trump, or they tried to, I heard this guy was murdered and this guy, or there was a guy with, whew.
Yeah.
It's more than their little brains can, it's more than my brain can handle as a 40-year-old woman, let alone these little developing brains.
Yeah. It's definitely a lot.
So even less extreme than like violence and political things and all of that. I read this article that was like, or watched a reel, I don't know, that we weren't even meant to see our own faces this clearly, this often. Like if you think back to just a couple hundred years ago, you might have had a mirror in your house or a window, but there weren't photos, there weren't phones, there weren't that many mirrors. People, you saw yourself in the reflection of the stream when you went to get water. Like we weren't even supposed to see our own selves this much. And so I feel like that's affecting people too, like all of it.
Also,
Just
think
like
of
insecurities. You mean
Yeah.
like just like, oh yeah.
Think of self-esteem.
Great
I was going to say with the filters.
Yeah.
That now there's pretty filters on things, so you could click it and you're like, oh, now I look like I'm photo shoot model ready. So even just that, it's not even, you're taking away all the authenticity of everything.
Yeah.
Yes, you are.
And it is overwhelming. But yeah, to see the things online or on TV from every angle on the phone every single day, just repeated. And I thought that stuff was supposed to be filtered out, but or censored out.
Well, and it's
but-
taken a crazy turn too, because we were having this conversation with my boys, because again they heard about it at school. Like they go to a little part-time hybrid program, but anyways, they heard about the guy getting shot in Minnesota, right? And so I was glad they came home and said, well, we want to know more about this. And I said, they asked to see the video, and I'm like, no, baby, it's nothing that any of us really need to see. And he's like, well, Mom, with AI, how do we know what's real? Like, how do we know that
Exactly.
he even got shot? And I'm like, bingo. We don't. And that's why it's not worth for us to watch this, read the news or watch the video, because all of it could be made up and we just don't know.
Yeah.
The only truth we know is what the Bible tells us is true, right?
Right.
That's just what I always bring it back to. That's the only truth we can count on. And that is our hope. And so it's also this world of like, that could be an AI generated face that we're comparing ourselves to. And that's a wild world.
Do you remember when video games turned from just Zelda and Super Mario to Halo and what they all are now? And I remember when like Grand Theft Auto was a thing. This is stuff that it's not that you can just play it, I would think, and be unaffected. I mean, I'm still very personally affected that I can't get my hands on Zelda. And that was trying to, use a magic sword to save the princess.
Yeah.
So that's the kind of stuff. We're getting mushroom on Mario. But you think of how much everyone's exposed to and how
violence,
the violence, the rise of depression, the rise of, I mean, especially during COVID when all those young kids were committing suicide was just because
So sad.
I remember a family member, he was younger because he was in, I think, still middle school at that time. And he said, I'm just feeling like anxiety because California schools were cut. You couldn't go to school. They couldn't play sports. They couldn't do anything. So you've taken a child out of this social environment and you've put them in locked inside with all they had was a screen.
Yeah.
So that was a terrifying moment. And I'm not even a mom, but for me I was always most concerned about the kids because I'm like, these are our future leaders. Totally. If you're messing them up because of all the restrictions put on them, and COVID was a whole other thing.
Yeah. So again, something I read or saw about video games when we were growing up were like, you had 3 lives. And it actually taught a little more resilience, a little more problem solving, a little more patience. You couldn't just keep playing the video game all day. You had to wait. And it actually produced positive characteristics. So I just wanted to throw that out there. But also,
That's so interesting.
Yeah, it was wild. It was like, oh yeah, it did. And now games are just like designed to be addictive.
Yeah.
But so community, the importance of community and like everything being online. So my older brother died of a drug overdose. And so that's a very important thing to me. And there was a study done on rats or mice that they addicted them to cocaine. And on one group of rats, they isolated them in their little rat houses, and that was it. And they all died. And they stopped, or they just kept pushing the button, right, for more drugs. And then this other, they built rat utopia, community, playground, like playthings, mental enrichment. But it was like they were together, and those rats stopped pushing the button for the drugs. And so that's part of what COVID did to everybody. Is take that community away. And that's what all this online stuff is doing. Take the community away and it makes people sicker.
Yeah, all of a sudden people are working from home because it's easier, right? They don't have to go engage, especially those individuals that are a little bit insecure and already socially anxious. And now they don't have to go work in a workspace. So they're content working from home. And then their health struggles because then they're just on their butts all day. And not engaging, not seeing the sunshine, not leaving their home. Yeah, we've created this. It's by design. They wanted it this way.
Yep.
I was going to say Megan and I rabbit hole really hard into all of this and the purpose to all of this, and it was such a crazy thing that we think now. Okay, it's almost 6 years ago that happened. I almost don't even remember what it was like.
We lived through a bad movie. Yeah, really. Like I still go back and I'm like, whoa.
Yeah.
And I'm so thankful we're out of it and we're no longer living in those circumstances because I think we all lived through that and said, like, what is this our forever? Like, is this the environment I'm going to raise my children in? And it was very disheartening.
They said 2 weeks.
Yeah. 2 weeks to cut the curve or whatever it was. Slow the spread. Yeah. But I think I am thankful because I think it did cause a lot of us to start critically thinking through all of this. And unfortunately, they didn't get the outcome they wanted.
Also,
we just got to keep fighting.
Also, whenever you hear, how sometimes they'll say, oh, Fauci said that another one is on the way or something. Yeah. I think so many people have woken up since then that everyone's kind of like, yeah, okay, don't.
Pass.
Yeah, like don't bring it. But
I'm going to opt out of that one.
But we're just going to
what a joke.
Like, because they've found the other ways and they realized so many of the things that happened. Everything just kind of, there was a lot of clarity that came out of COVID. And, in the midst of it being detrimental in very many ways, there was a lot of clarity, and I'm grateful for the clarity just to be able to have conversations with people and then find out that I never got vaccinated because I'm like, why would I don't even get the flu shot. Why would I I'm autoimmune. There's no way.
No way. Yeah. Good for you.
But you're a grandma killer. I'm like, okay, totally.
Well,
you're so selfish. I'm like, am I though? Or
no,
am I
I
just
have an
smart?
immune system. Yeah. That's how I used to tell people.
Yeah.
And my kids.
My immune system knows what it's doing.
We're good.
We built it. Barbara O'Neill says you have an immune system. Yeah, and I think that's what's nice about people going to functional med is you have somebody there that will help you on the journey to improving your immune system, improving your whole systemic function, so you don't have to fall prey to these shysters.
Shysters, I love it. Shysters. I love it. Yeah, no, it's definitely it's an honor to get to do what we do and get to grow and continue to just educate other providers coming on board. And yeah, I love it. I feel humbled every day. It's been a wild ride. Owning a business is no easy feat.
Oh, yeah.
And especially growing a functional medicine practice in this, like going through COVID was, it was probably one of the hardest things my husband and I have ever walked as business owners. We actually had, this is a wild story that I can share. I don't remember what year it was, probably the second year of COVID. We had an audit. At that point, at that time, we didn't, not much of our practice was cash pay. We're mostly insurance. And our heart is truly to stay in insurance. We want to keep our functional medicine affordable, right? As long as we can continue to exist as a business, we want to make it affordable for people. But we got a letter from one of the insurance companies, our majority of our coverage for our clients, and it said you're what was it? It was you're in an audit, which we honestly didn't even know they could do this.
I didn't know they could do that.
Yeah, they can
That's
audit
wild.
they can audit any group or any company or hospital system or clinic and withhold payment. And the reason was we found out, a few months into this audit, they withheld funds for 6 months. It almost took us out. And the reason is because we ordered too many vitamin Ds on our clients during COVID.
Well, yeah, because vitamin D and zinc was like the A1.
If you didn't have a vitamin D of at least 30, you were pretty much guaranteed to be hospitalized with COVID. And so and we had no leg to stand on. We had no fight in the battle. It was guys wearing ties in a suit in some tall building deciding how we should be doing medicine and how we should be treating. And literally the crazy thing is that what they didn't look at was the data that if we got our patients' vitamin D levels up, we kept their clients out of the hospital. So we saved them so much money from hospitalization.
Yeah, but then if you...
Thank you.
But then if you are hospitalized with COVID and then you have to go on a respirator,
Yeah,
then
you
the
have to be intubated.
hospital's going to get extra money. And then who's getting that kickback?
It was real dirty.
Yeah.
Real dirty.
Super dirty.
So that was honestly kind of our launch into more of the specialty cash pay care, is because I was our second provider that went all cash, because I just did not want to exist in that system where someone else that had no medical training could try and dictate how I practice medicine and how I got my clients well. And it was like something I looked back and wish I would have done years earlier. And what most people don't realize is that there are so many ways to get good medical coverage that doesn't have to be the conventional way, right? You don't have to have this conventional plan. There's so many cool health shares that are out there, and some of it actually covers functional medicine and covers supplements and herbs. And so that's kind of another little hidden secret most people don't know. Additionally, like in all three of our clinics, we have a laboratory called Interpath Labs, and it's all cash pay pricing. We have negotiated certain prices with them because if you go to I had this experience Monday. I had to take my kiddo for x-rays. He hurt himself and we had to go get x-rays. And this nice young kid at Intermountain Medical Imaging down the way said, well, is this your current insurance? And I'm like, well, we just want to pay cash for these x-rays, right? Because we have a $10,000 deductible that we never meet because we do functional medicine, right?
Yeah.
But as a business of more than 100 employees, we have to have conventional coverage for our employees. Don't get me started on rules like that. But I said, well, can we just pay cash? And he's like, well, no, you can't pay cash if you have insurance. And I'm like,
I know, that's the dumbest thing.
it is. And I'm like, oh yeah, I forgot. And I'm like, I'll deal with your billing department later, right? But the same thing with labs, right? Mm-hmm. You have to use your insurance if you want to go get your hormones checked, right? I have had multiple clients that come back to me because they go to their conventional lab using their conventional insurance coverage, and they get a $3,000 lab
Mine
bill
was
for one of our. Yes, or $4,000 for one of their functional lab panels.
And I had
called
called
a lot of labs.
The insurance company ahead of time and ran through every code. And I was as fast as I was going through those codes, I was like, are you writing these down? Are you actually checking these?
Yeah.
And she was like, yeah, everything's covered. I was like, are you sure? Should we do this again? And then I got a bill for $4,000
because it was probably her third day on the job.
Yeah.
And it's so complex for educated people like me and you to understand that how would we expect that person in India answering the phone, I'm so sorry, but so that person across the ocean answering the phone that maybe doesn't actually know what they're doing. It doesn't actually know because there's multiple there's a procedure code, there's a diagnosis code. What's the code? Like it's so complicated, right? So long story short, we've negotiated these cash pay prices for our clients, and a $4,000 lab bill can become $450. I'm not talking $300 in savings. I'm talking potentially $3,500 in savings.
Yeah, when I was
because
done,
you're bypassing insurance. Megan, I hear stories like this all the
Yeah.
time. And it's wild. And that's, again, comes back to our conversation we had about you have to be your own advocate.
Yeah.
You don't walk into a car dealership and not know the cost of the car and walk out and get billed 2 months later. You go in and you negotiate. You ask for the price of the car. You want to make sure that car is clean before you walk out and make that payment.
Yep.
It should be no different in healthcare. There should be no surprise costs. You should not leave your hospital visit and then get a $45,000 bill for a 30-minute procedure. Like, what is going on? And so we're all about upfront costs and not trying to keep things hidden.
600 milligrams of ibuprofen are going to cost you $300.
In the hospital.
Yeah.
Yeah.
Well, and it stresses my husband out, but I will not pay a medical bill, until I get the EOB that matches it.
Yeah.
And I will
Check for those errors.
fight it.
Yeah.
And some providers that we have always been just dead on. So at this point, I'm like, yeah, pay it. But I'm a stickler for that.
Yeah. It's a big deal. And most people also don't realize, like, if I'm an out-of-network provider, because I don't take any insurance, and obviously I'm opted out of Medicare and things like that, there are, in the fine print, there are some healthcare insurances that will cover out-of-network providers at 50%. So you can go see like a cash pay naturopath or functional medicine practitioner, and you just have to do the work on your own. It takes more
get
work.
your super bill.
Yeah, but get your super bill, reimburse that, and you might get a check from your insurance company. But I mean, they don't want you to know that, and they don't make that known. But it is a thing. So again, just be your own advocate. Take the time, because it could be a significant cost savings for your family. And while you're at it, look at the health savings plans that are out there, because there's some really cool ones.
Oh, yeah.
The premiums are way less expensive, and they actually cover some pretty cool stuff.
When you think of me as an individual paying almost $600 a month just for a premium, it's crazy.
What could you do with that $600 a month on your own?
Much.
Yeah. You could choose some different plan just to get like catastrophic coverage. Heaven forbid you get in a car wreck or get hospitalized, but you could have a plan that costs you half that much and actually covers some of your supplements and some of your holistic care. Yeah.
Which would be amazing.
Yeah.
Because it's just, I don't go to the doctor very often anymore, which is great. I get migraine treatment every 3 months. That's one thing that's actually provided me tremendous relief.
Good.
Because all of the medicines that I was on gave me the worst side effects, and I would have 17 migraine days a month where I was debilitated. You can't function. So this is the one thing. I failed so many drugs that the Botox helps for the migraines. So I'm like, I'll keep doing it. That's something that's a non-negotiable for me at this point. When you find
there's a time and a place for conventional medicine. I'm so thankful that if my kid's x-rays didn't turn out well and he, heaven forbid, needed surgery, I'm so thankful that I know some wonderful orthopedic surgeons here downtown that could get him in.
Absolutely.
Right? But let's be honest, the majority of the medicine we need is preventative care and managing chronic conditions like obesity and type 2 diabetes. And the number one killer of men and women is still cardiovascular disease. But most of us are going to go down with a heart attack or a stroke, right? If we're over the age of 50. Under the age of 50, did you know what the new number one killer is? Colon cancer.
What is it?
Colon cancer.
Really?
Interesting.
It was just announced like 2 weeks ago, right? And that goes back to the gut microbiome. What are we eating? Our colon is one of our main organs of detoxification. We're not pooping every day, fully eliminating. So it's wild. And when you look at the data on the individuals that are over age 50, right, we talk about the 4 horsemen of chronic disease. So cardiovascular disease, diabetes, cancer, and osteoporosis, metabolic bone health issues. 3 of the 4 women are going to get it significantly earlier than men, right? Mm-hmm. Cardiovascular disease, osteoporosis, and diabetes. Because we all lose estrogen in our 50s. Mm-hmm. Our estrogen goes plunk as soon as we hit menopause, right? And estrogen is so protective to our cardiovascular system, to our brains. Sorry, I didn't mention Alzheimer's. Diabetes and cardiovascular disease are in one category. Alzheimer's is that separate horseman. The only one where men actually will do worse than us is cancer. But it's not like statistically we're that much better. 1 in 3 women will get cancer. 1 in 2 men will get cancer. But we have to look at that data for those individuals over 50 and say, like, okay, that's another. It goes back to that conversation of ask about your hormones. Please, practitioners, become educated on the benefits of things like estrogen and how protective they are to the body when we're talking about the number one, killer of men and women, and what's going to take us down and cause us to be ill and use up all our healthcare dollars and ultimately watch us suffer, right? Like Alzheimer's, dementia, it's a terrible disease. Terrible disease. And if we know how, we have medications that can maybe halt the progression of it, maybe, and they cost thousands of dollars a month. But we know estrogen and to a certain extent testosterone can reverse Alzheimer's, right?
Yeah.
Why is that not being talked about?
Do you see on a functional medicine side, I remember when I started following this diet years ago. And again, I don't follow it religiously every day anymore because there's some balance. I can float in and out of my ketosis.
Yeah,
I'm
which
fine.
is great.
But there was data at that point that it was helping people with cognitive function, like a high-fat keto diet.
Because 80% of your brain is fat.
Right. And then epileptics as well.
That's how it originated, actually.
Yeah.
Was for children that had epilepsy.
So
was
that's
how the keto
legit.
diet
That's not
originated.
just something we were all told. That's what I
it's
thought.
totally
I figured.
legit.
I was
Yeah,
like,
it's absolutely legit. Well, because you know what they call Alzheimer's and dementia now? The new name? What is it, Megan?
Diabetes type 3.
Type 3 diabetes. Because we know what those glycated sugars, those glucose molecules, what they do to the brain. They destroy the brain. So even more reason that we need to catch somebody that has an A1C that's starting to climb before they become a diabetic, because we can save their brain.
That's crazy. I lost my grandpa to Alzheimer's. Like that was the final thing, but
Yeah.
I think he was also taking the meds for diabetes.
I would not be surprised.
Yeah, and that was just, it was so sad to watch someone you love go through that.
Oh, it's the saddest condition.
And he actually, we were very fortunate because we've heard a lot of stories of people get very angry so they can flip and be very angry when they're when they don't remember. Yeah. He was like childlike, very, I mean, that was a beautiful thing, I think, for us because he died in 2020. So he was at home with caregivers, thank God, because if he was in a home, we would have never even been able to see him. He died July of 2020.
Yeah.
So you look at that, but my grandpa always said this thing that he would always tell me whenever I had a cookie or anything, he'd always be like, "You're addicted to sugar." That was always his thing. Like and he was an immigrant. He's like, "You're addicted to sugar." I'm like, I'm not though. I'm like least addictive. I'm just a kid. I'm just having a cookie. Yeah. So it's fine. But whenever I go get anything sweet, even today, his voice is always in my head. Like if I go get 2, it'll be like, "You're addicted to sugar." I'm like, "Yeah, but I'm in Italy. I'm going to have 3 pastries actually. We're going to do it." But that's really sad that it's that's one of the main killers. Alzheimer's.
It's so sad. Well, and we have peptides that it's interesting. There's 2 years ago, these peptides came on the market. Dihexin, cerebrolysine were 2 of them. And the FDA pulled them last year. So, no, we're not going to use those anymore. And the science we were seeing coming out about these peptides and how it benefits the brain and can reverse Alzheimer's, it was astounding. So, yeah, that's just, again, kind of this red tape that I'm talking about that Big Pharma controls. And because if people start to reverse Alzheimer's naturally, whether it's through diet, hormones, or peptides, that doesn't make anybody money.
Disease is too lucrative. I was going to say it's so lucrative. I'm of the firm belief, I think you are too, that there's a cure for cancer out there somewhere.
Oh, 100%.
But you know, there's something. There's some, whether it's the guidance of like, you can't market it. If you just saw someone and took care of all of you, right, and not took drugs and big pharma stuff, but it's just not lucrative.
Yeah.
And how sad that we're all kind of. I was looking. You remember the Sorry? Sorry is the game that had. It was almost like the person token. We're all those in this big game of medicine. I mean, that's how we're all viewed, and that's so sad because everyone has a value to them.
Yeah.
Of how much that they can make companies, and that's really a disturbing way to actually look at it. I'm sorry, I said
the human race. No, it's reality. Though.
It's true.
It's reality.
But I don't like being a pawn in a game of, and I need it. Like I need to have
You're relying
people
on the system.
looking out for me. I need to be monitored, which is why I still have to kind of check all my things and make sure we're okay because I never want to go. There's certain drugs I'll never go back on. I just had to see a new rheumatologist recently just to establish care here. And I think I was with her an hour and a half and I broke down at one point and I was like, I will not go back on prednisone like ever in my life. Like no way. Because that made me the craziest and it did the most damage to my whole body overall. I got melanoma. Why? I mean, I'm fair. Why? I never go in the sun because of my lupus. There's so many things, but now I'm like, I'm also deficient in vitamin D. That's your purest form of vitamin D is getting it from the sun. And then you talk about sunscreen and everything that's in sunscreens. So once I think you open your mind, which is what happened to me during COVID, now I can't unsee. Kind of like when I started training to compete, I started only seeing food in like fat, carbs, and protein. Those that you can't see it any other way. That'd be a really good cupcake. I'm like, that was like 75 grams of carbs. I don't think I could do it. Can't do it. So it's just an interesting thing, but I do love it. Can I ask you, what do you find, I guess, in the practice overall, not even just your patients, do you find what a main common thing that most people are deficient in? Would you say it's vitamin D?
Yeah, and magnesium.
Oh.
because our soil is so depleted, and because when you're stressed, you pee out magnesium.
Well, and I
The
think a
magnesium's
lot of, if people aren't eating like local veggies, they're not getting as much, because I feel like the produce now is less nutrient dense than
And
it
it's
used to
because
be.
of the soil. It's because our soil has become so depleted, whether that's because of chemicals in the air or what we're spraying our soil with. It's just so nutritionally depleted. So yeah, it's so true that a blueberry that we ate as kids is no longer the same nutrient content as a blueberry today.
I feel like nothing is the same as when we were kids.
It's honestly not. It truly isn't. Like, we weren't exposed to glyphosate until the 90s. So those of us that were born in the 80s, right, we didn't have the kind of herbicides and pesticide exposure that our kids now are exposed to. Yeah, it's micronutrients, and a lot of it too is also, you have to also think, it's not just our environment, it's also internally our guts. We're not absorbing food like we should because we all have poor gut health, because of the antibiotics, because of the stress, because of the screens, because of the toxins. It's kind of just like this double-edged sword. So that's another reason we focus on a lot of gut health. When I saw a client like this yesterday, she didn't have one nutrient that was actually like even close to optimal. And so instead of just loading her up on supplements, because that's another form of polypharmacy, right? I'm going to look at her gut and work on her gut and make sure she's absorbing the good quality foods that we're getting her to consume, and eventually able to absorb some of the supplements that I'm hoping to be able to give her. But so, yeah, you kind of have to have this multi-dimensional approach to these clients, and not just this linear. And that's the difference too of a conventional approach versus functional. It's not just linear. It's not just, this is the causative effect. It's like, well, that's coming back to what you said, Megan. Like, it's a whole body system, and it's all, like the vagus nerve, for instance, right? Like, we've got the vagus nerve that connects our brain to our gut, and it's the largest nerve in our body, and it is responsible for not only shifting us between our parasympathetic rest and digest to our sympathetic nervous system, but most people don't understand is it also is imperative and important for the digestive system. It helps make stomach acid, right? And stomach acid is something that we need to break down nutrients and absorb nutrients from our food. But we all just go on omeprazole if we're having a little bit of indigestion, or our docs give us omeprazole because they actually can't figure out our abdominal pain or our GERD. But that medication was never intended to be taken. It was indicated for gastric ulcer, and never intended to be taken for more than 2 weeks. And so it's like the number one prescribed medication in the world. And so now everyone's taking these PPIs, or they're grabbing it over the counter because you don't even need a prescription to get this. And we're all depleted of stomach acid. So we're not breaking down food. We're not digesting supplements like we should. And guess what parasites, bacteria, and fungi and viruses like? They like an acidic environment. They like an alkaline environment, right? We want to be holistic. We want to be head to toe mostly alkaline, but in our intestinal tract, we actually want to be a little bit acidic, right? Lower pH, go back to like high school science, lower pH, because that's where some of these bad guys can't thrive. And so it's so much bigger than just fixing the symptom and figuring out why you're not breaking down food. I'm going off on a tangent. I don't even remember how we started here.
That's okay.
But yeah, gut malabsorption, not absorbing nutrients. So it's so much bigger than just take your vitamin D and go on your way. It's like looking at the system as a whole, like, well, tell me what else is going on. Yeah. Are you having indigestion? Have you been on PPIs? Have you been on antibiotics that can also, damage the intestinal tract and affect the vagus nerve? And by the way, are you putting your screen down at night and letting your nervous system heal so that you can properly rest and digest? Or are you stuck in fight or flight?
Yeah.
Are you a kiddo that was, I hate to say it, but like molested as a child? The amount of times I've said to people, I'm not sure you've ever not lived in fight or flight. And they just break down, and they're like, "No, I don't think I've ever shifted into my parasympathetic nerve."
Yeah,
you can't heal if you're always running from the flipping tiger. And maybe it started, with neglect as a child, and then you had an abusive boyfriend or a really broken marriage or a toxic boss, and now it's led to an ailment like an autoimmune disease, and that's going to keep you stuck in fight or flight. If you're always sick, you're always running from the tiger, right? And we were never meant to always run from the tiger. Yes, we need to be able to perform. Yes, we need to have our cortisol shift so we can run and catch, our baby that's falling or whatever. But we have to be able to shift back into rest and digest. And it's just imperative. And it's probably one of the most things I'm passionate. Never thought I'd be that passionate about the nervous system and the vagus nerve going into functional medicine. But it's so important to recognize.
Yeah. Well, and I think another thing that just popped into my head is having this person to walk with you in this journey, because it's so overwhelming.
It's so overwhelming.
Where do you even start? And so to have somebody that goes, let's start with your gut. Yeah. Let's start with this one thing, get this one thing dialed in and see that ripple effect. And then you can start working on the next thing. You don't have to just be optimal tomorrow.
Yeah. It is. It's a really overwhelming journey. And I actually have probably more clients than I'd probably even know that like don't come back because they're so overwhelmed, because I get so excited and I talk so fast and I'm so passionate about it all, right? But you're so spot on. And it is like, even just if you can get that client fully I'll go back to the constipation example. If you can get that client to fully empty their bowels, that tells me a lot that their gut health is improving, right? And then maybe their mental health improves.
Yeah.
Because you make 90% of your serotonin in your gut. And we're all walking around in SSRIs that
don't get me started on
that
SSRIs.
aren't actually increasing serotonin in the body. They're just putting out more receptors to try and bring more serotonin in the cell. But your gut makes 90% of that. So if we fix the gut, maybe you won't need this medication that can cause suicidal ideation or cause you to gain 50 pounds or cause your libido to go out the door, and then your marriage isn't great. Yeah. And there's also a supplement called 5-hydroxytryptophan, 5-HTP, that is the precursor to serotonin. So I sometimes will just start my clients on a little bit of 5-HTP and that light bulb comes on. And that's amazing to see, to know that I don't have to rely on a pharmaceutical to get them out of their state of depression while we continue to work on it. So yeah, there's sometimes, Megan, it's even just to not overwhelm them. Oh my gosh, you're only sleeping 5 hours a night. Let's just get you sleeping.
Yeah.
Let's try this, and this to get you sleeping, because that can make the world.
Well, there's a reason that sleep deprivation is a form of torture.
Yeah.
Like, yeah.
Prisoners of war. Yeah. We don't let them sleep.
And that's, that was one of my things. Because if there was a Stanley Cup for sleeping, I would have my name on it. Like, I am an excellent sleeper. And when I started not sleeping through the night.
It's terrible.
Was like, what?
That was your hormones,
yeah.
I assume. Yeah.
And so getting that dialed in was
game changer.
The game changer. Yeah.
For you and your family.
Yeah.
Mom's happy. Mom's alert.
Yeah.
Mom feels better.
Yeah. So finding and having the time to sit down with that person as that individual person rather than just, a 20-minute window on your schedule to find out what is the small first step that they need to take, because it's not the same for everybody.
Yeah. And it's not just saying, oh, here's some Ambien.
Yeah.
And guess what? You're actually never going to get into a deep sleep with Ambien. So your cells aren't going to recover, regenerate. It's not actually going to, it's just going to make you in this lighter phase of sleep that's actually not going to help your health.
Yeah.
Right?
It's so crazy. I'm still the worst sleeper on the couch then, because I go through periods where I have insomnia for weeks and weeks on end, and I'm just maybe 2 hours a night, maybe, and that's not even real sleep, but I can still function. So I don't know if that's whatever mode I'm in my life, but I can still push through the day. I do go through waves, though, where I get hit with chronic fatigue. And that was last week for me, where every morning I was just thinking there's no way I can function or keep my eyes open. So it all hits me at once. But I can't do Ambien or anything like that, because Ambien is the weird thing. Ambien to me is like giving some dogs Benadryl, where they have the opposite reaction.
Yeah.
And you're like,
I'll be up
happen.
for 3 days if I take a Benadryl.
Yeah.
Can't. Oh, so
well, that's your
Benadryl,
mast
like,
cells are all off because your histamine issues.
Oh, yeah.
That's what that is.
Well, and so now that my hormones are dialed in, that's the next thing that we're working on is the dehist. I just don't want to deal with the loading dose yet. I have to find a week that I can.
That you can manage to take that. Yeah.
But yeah, because I don't want to be on Zyrtec every day all the time either. And yeah, so it's interesting because like you have a gut thing, but you can function on no sleep. My gut is apparently ironclad. But if I don't get enough sleep, I'm a little bit psychotic.
Yeah.
Yeah.
I think my body probably just went into a survival mode. I mean, I tend to live a lot in survival mode for a lot of things, but I'll get to 9 p.m. sometimes and I'll be like, oh, shoot, did I eat today? No. So then I'll eat. So I can survive also on no food, doing a whole day of work, doing a workout. And this is not a flex. This is like a bad thing. I know it's a bad thing because I just can't get it together. But if I'm too stressed about other things, then I just don't eat. But then if I do eat, a lot of times I get nausea. So then it becomes is it worth eating? Like, to avoid that, I'll take one over the other. And this is the lesser of the evil because at least I can function. I don't want to feel sick. That's not fun.
Right.
Autoimmune's a weird life, just from treating it. It's a weird thing where you just kind of become accustomed to, cool, I'll never be normal like that. I can never go on benders.
Yeah.
Nor do I want to because, hello, I'm 42. Let's grow up, kids.
We like to be in bed. What was it like? Your biggest punishment as a kid was like go to your room and go to bed.
Yeah.
We're all as 40-year-old women. We're like, yes.
Oh,
that's
yes.
what I want.
I just want the punishment of falling in bed and like sleep. Sleep is so crucial.
It's king.
I love it. Do you recommend for people who maybe don't have the biggest appetite that they do take somewhat of a good multivitamin?
Yes.
You have
Yes.
those at your clinic.
Yeah,
right? You have all those.
I think a multivitamin for majority of individuals is really important. Again, going back to just malabsorption issues and soil depletion, and that we pee out more certain nutrients when we're stressed out. I also think like in someone that maybe their appetite's suppressed or there's gut issues, protein. There's a lot of really good clean protein powders out there because we're all at an age where we're all what we call becoming sarcopenic. Actually, usually starts in our 30s. We're losing lean muscle mass, right? And muscle is our organ of longevity, and it's our glucose disposal sink. So it's how we manage our blood sugar, which, high blood sugar leads to aging. And lots of other issues, oxidative stress and inflammation. So we have a lot of good quality clean protein powders we recommend. And then I'm a big fan of branched chain amino acids. So there's a company out there called Perfect Aminos, and it's like the perfect combination of your branched chain amino acids that are the building blocks to protein. So even if I have a really busy clinic day and I know I just didn't consume enough calories or especially protein, I will dose my amino acids twice because one serving of Perfect Aminos is about 29 grams of protein.
Wow.
And so
nice.
it really helps you get those protein needs met because truly we're at a phase of life and where we need to be getting grams of protein per pound of body weight. Right?
And that is just so
It's
hard to do.
It is a part-time job.
It
right?
is.
And even in kids, we're starting to recognize they don't need that much protein, but they need protein for their brains and for their little growing bodies. And so it's there are ways, I don't want to say cheat the system, but there are definitely tricks of the trade to help get those protein and nutrient needs met. Electrolytes is another important part of that, right? Because there's some electrolytes that are really good quality, they're clean, and they've got certain micronutrients in them like magnesium and potassium, and so it helps meet your needs when you're undernourished or you've got gut issues and you're not absorbing. So yeah, there's a lot of omega-3s. Fish oil is another one because a lot of us aren't eating good quality wild caught fish 5 days a week. And having enough omega-3 in the system is very anti-inflammatory, supporting cardiometabolic disease, supporting hormonal health. We actually make our hormones, our sex hormones, from cholesterol, right? So that's why these gymnasts don't have cycles because they don't have enough cholesterol and fat in their body. So cholesterol turns into our master hormone, pregnenolone, and all of our hormones are made downstream from that. So you can have something as too low of cholesterol, and then that could be leading to inappropriate sex hormone metabolism. So yeah, supplements are game changers. And there's some that most of my clients are on. Vitamin D, a lot of them are on multivitamins. B vitamins are really important. Magnesium, I mentioned that. Fish oil, some form of omega-3. Yeah, I mean, I could go on and on. But from there, it really is a personalized approach, right? That's where we do some of the testing and, gut health, probiotics, prebiotics, immunoglobulins that help heal leaky gut. That's where a lot of that just comes in as individualized care.
I came in today thinking I'm sure a lot of people are deficient in so many things. It makes sense about the soil.
Yeah.
Vitamin D is, I know that when I was chronically low vitamin D, I had all the basic symptoms that you would even see on, WebMD, where everyone thinks they're a doctor like me, or Google. But it definitely attributed to a lot. And with lupus, they want your levels higher.
Yeah,
they
absolutely.
Need it high. Like that's what I've always been told.
Yeah.
So I am happy that I've curated at least people, with the exception of a GI, that at least I can just send a message and just no one's going to shove drugs on me, which is so good because I don't want to take drugs.
Right.
I've played that game. Like I
Right.
would rather just
Right.
see you
Yep.
and have all of my stuff taken care of
Yeah.
because it's so overwhelming. I want to be able to have an appetite. It's not that I don't. And I think a lot of people probably go through weird struggles in their own health journey of whatever it is that they're experiencing. But it does just get to the point where you can either kind of like fight it every day or you just give like whatever. And I'm at that, I have too much stress to deal with it. So to me, it's like, whatever. I'll just, I guess, fly to Italy every couple of years and eat there a few, at least.
Or import food.
At least
Spend
twice.
$1,000 a week
day.
on food getting imported from Italy.
Yeah.
And
So
and
it's
my response to kind of what you're saying is, and as my mind's going, I'm like, oh, I would love to see a salivary cortisol curve on you to see where your cortisol is doing in a 24-hour period, right? Because again, when you're running from the tiger, when the ancient warriors in our day, like you just need to run. You just have to keep running. You're not sending blood to the digestive tract to try and break down food, right? You're not trying to make hormones. Your body's not worried about making babies. You are worried about running from the tiger, from your offender, right? So your brain isn't thinking, I need to fuel up. Your brain is thinking, I need to exploit my blood sugar and send it to my extremity so I can perform. That's what I'm thinking with you. Like that, your cortisol is just.
And that makes sense. And I probably also, to be honest, have a little bit of PTSD because in 09 to about 11 or 12, when I got to stop all my meds, I was homebound. I mean, I was sick. I was either in the hospital or at home. That was it. I had no life. Drugs destroyed me. That was the worst of it. And I had it really bad years before, but that was the worst of it because the kidney function just wasn't responding to anything. So I think it's a lot of PTSD. Like, I will never be sick again. I will just do it. Like, I will, but I always have to allow the room for autoimmune to autoimmune. Like, it's gonna, it's just the way, and that's my mentality. And that's not a good mentality, but at least I know that. At least I'm aware.
And you've learned how to be able to function within your system and what your body needs. Yeah.
I would go in for chemo treatments and then I would take a Zofran the next morning and I would go to 5:30 a.m. spin. And that was my way of and that's why, like, in that phase, and I had great spin instructors and everyone was super supportive and they knew, but I just remember popping the medicine the next morning and going because I was determined that I'm not going to let it consume me. I'm not going to let it take it over me. I'm going to live my life. I'm going to overcome it. And I would just like Zofran, pray, go. And I never had a weird episode, but that was my thing. That was just, I had to do it I think it was to feel alive. Everything I always say, it's always because I wanted to feel alive.
I won't let this consume me. I won't let this be my identity. I'll still do the things that I love and take care of myself.
And I got sick at 13. I mean, that sucks. Nobody wants
your life
that.
Sick.
My whole, all of it. So now it's like, cool. Now we're better. So it's weird because I got sick at 13. Now I'm in my 13th year of technical remission. So that whole phase in between, you're in the mode of just survival. Right. So then it's like, okay, well, I can keep continuing like this. And it's just a weird thing. But I think coming into this next phase of my life where I don't even know the red flags. You said you had hot flashes. Like, I don't even know the red flags. Like, what are they going to be for me? Because everyone's so unique. When do I need to start thinking about this? Is something going to go off?
You might breeze through perimenopause. Your story won't be the same as Megan's.
Right. Yeah.
Guaranteed it won't be the exact same. There's like 300 different symptoms of perimenopause and menopause, right?
Well,
my mom was a big hot flasher.
And none of us knew that.
No, we never knew to recognize it.
Like, do you think that women before us weren't talking about it?
Yeah.
Or
they just kind of suffered in silence.
Did they have different, like, is it worse now?
Well, it's worse. Why is it worse?
Is our collective cortisol higher?
Hour talking about cortisol, trauma, nervous system, toxins. It's our environment.
The pace of life.
Gut health. Yeah. The pace of life. Like, that is all disrupting our hormones significantly more than it ever did. Like, just look at infertility. Yeah. Like, as we never used to deal with, men and women, like, these issues of infertility. Like, it's wild how many people have to rely on reproductive health to help them have a baby or just rely on adoption because they can't have babies. God never intended us to not be able to reproduce. Yeah. That was never part of his plan. We've done it to ourselves, right? Or cancer. That's another, like, hello, we can't just blame our genetics on cancer. It's environmental. It's the environment we're exposed to. It's our genes interacting. It's called epigenetics. Our genes interacting with our environment. We've never before seen a world like this, right? And so it's, like, I am the freak that is same as what you were saying, like the way I talk to my kids and the way we interact in our home. Yes, I'm not going to be a freak about it. We're going to go outside the home and enjoy birthday treats and stuff, but it is far and few between. Because we treat our bodies like a temple. And I just know a little bit too much to be dangerous. It's actually really hard to exist in my world and, like, enjoy the world truly. Like, it's hard to eat out and, like, enjoy it. We also don't have great options. It's getting better in the Treasure Valley, but there's still not a lot of fabulous options to eat out. But it really does zap the joy of enjoying things like restaurants or going on vacation. Also just because, like, we don't feel good when we go on trips. Like, my family doesn't feel good. Yeah. Like, we tried to enjoy a trip to Cabo. I had GI issues. My son got an ear infection because he was eating. It was like an all-inclusive in the buffet. And I was like, oh, good Lord, what are you eating? Right? But it's just like our body doesn't respond well because we're not used to that. We're used to putting pretty clean things into our system.
Well, so. When we go on vacation, my husband is wrecked because you're eating out and you're, all these things. But when we went to Canada a couple years ago, he was bracing himself to just be wrecked. And he was like, I don't feel that bad. And I was like, well, because I make all our own bread products at my house. And, but you're on vacation. I'm not going to, like, I think I probably did bring a loaf of bread, but when we were out of it, so let's go to the grocery store. And he was looking at all the labels and he was like, this is incredible.
This is amazing.
We can buy this bread.
Yeah.
You know, and it wasn't just loaded with seed oils and all kinds of crap. And so he was like, well, this is the first vacation we've ever had where I don't think I'm going to die.
That's great.
From eating all this food. Yeah. And so it was like, we still had Doritos. They just weren't probably as flammable as the Doritos we have here.
It's so true.
You know, you can eat the things, but it's just like, can we have some more informed consent about what we're actually eating?
What we're putting into our body.
Yeah.
It's coming.
I hope so.
It's going to be a slow change. It might not stick, but the awareness there's some awareness out there. It's coming.
Can I ask your stance on, I mean, I know your stance, but can I ask your general, I guess, feedback or input on, we are going through a side movement in this whole health movement right now where people in their 20s are stopping to drink, which I think they're choosing to not drink, which I think is actually a really cool thing. I know a lot of people are, they say, you know, their rebuttal is, but then they're not being social and then they're not being this. I know that every now and then I enjoy a really good filthy martini. I don't do wine. Wine makes me sick. I'm the worst Italian ever. I'm more Russian leaning with my alcohol.
But can you drink the wine in Italy?
I don't like. I don't want the sugars. No, I
bet you could.
I probably could, but I'm like, you know, I just don't even want to. It's not my jam.
Yeah.
But when I hear, so I feel so much better is the point when I don't drink. And I went through a couple months recently, and I think now another month that I just haven't drank, and I feel fine. But I love that the youth is doing it because they're recognizing. So I don't know, what do you think prompted that movement? Do you think it was this whole Maha movement, or do you think it was people just actually recognizing, wow, I can perform better, whether I'm an athlete or whatever, I could perform better the next day. I don't feel gross in that. The biggest misconception to me was always when you get super drunk, especially in college, there would always be the thing was you have to go out the next day and you have to eat a super like gnarly, nasty, greasy
Soak
meal.
It all up.
I just never, I think resonated with me.
I was big on that.
No, I'm a saltine person. Just give me the saltines, give me some bread or whatever. But do you find that, are you seeing that more in, like, with your patients, do a lot of is that something that you would say that alcohol, you would teach, you know, you teach them about, I guess, the long-term dangers on your overall health, because it is poison. I mean, none of us are in denial about that. Most people know that alcohol's poison. So I just like that there's a whole movement about it with young kids. It's kind of hopeful.
Yeah, the awareness is definitely a wonderful thing. I stopped drinking. Last time I had a drink was at a Boise State football game in November. And it's crazy how I don't crave it. Like, you probably don't even, like, I don't even really crave it. And I used to get to a Friday night and I never like drank every day, but it was like Friday night and I just would really look forward to and I always made really clean cocktails with like electrolytes and all these things, you know, a little bit freakish like that. But yeah, and I don't know. I think that there's been so much more awareness. I think as women, you know, getting in our 30s and 40s into perimenopause, like, you no longer can enjoy a couple drinks and like actually sleep well, right? Like, it affects you. The sugars, the alcohol, what your liver's trying to do. Like, waking up at 3 a.m. is actually when your liver's trying to detox your system, right? And so I don't know if it was actually that more our generation started talking about it more and was more aware, therefore the younger generation just started listening, or if they actually prompted it. It's a great question. I don't know if it was the chicken before the egg or how that worked out, but you spot on. It's a poison. It's really damaging to our gut microbiome, to our liver, to our hormones, to our brain. And when you look at the data on cancer and Alzheimer's, it's astounding what alcohol does. And then there's still some people that are just like not paying attention to it because we need something that numbs us from the world, right? Like, I love how I feel after a cocktail, truly. I love just feeling relaxed, but I can no longer rely on that, knowing what I now know and knowing what it does to my body. Plus, there's also that mom guilt of like, oh, mom needs a nap on a Sunday afternoon. That's ridiculous. That's ridiculous, right? Like, I don't want to live in an environment where that's a necessity. But yeah, I'm thankful. It's interesting. I actually have a lot of people that work in the alcohol industry that are clients, and they're struggling.
I bet
that industry is struggling. Those hops farmers and the beer and alcohol sales, like, it's pretty crazy to see.
There are so many non-alcoholic beer choices now. Yes. It is wild to me because my husband did Dry January, and so but he loves a good beer, and so he was like, great. Go get me some non-alcoholic beer. And I was like O'Doul's? And I went, and it was like a whole section in
wild.
the case, and I was like, oh, okay.
Yeah. It's interesting that it's just like it's like the societal norm to just have something in your hand. And I don't care. I'll have something in my hand, but it'll be my amino acids or my electrolytes or, there's so many there's what's it called? It actually has like L-theanine and ashwagandha in it and green tea extract. It's a drink. Oh, I can't think of it. You can go get it at Whole Foods. You can get it at a lot of different stores now. But there's so many drinks like that nowadays that have like herbs in them that actually can have a little bit of a calming effect on the brain and the body, and it's non-alcoholic. And it's just, I think having a drink in your hand is the societal norm. It's so interesting. But yeah, I'm very thankful. And that's sometimes honestly where I start with my clients. The amount of men that I see, not as often as it was 3-4 years ago, but I probably drink 10 beers a day. And I'm like, okay, that's where we're going to start. Let's go. And it's not you have to stop drinking.
Right.
It's
maybe make it 5.
80-20. Yeah. What does this look like to maybe think about weekends only where you're consuming and taking your break, and then you'll see how much your sleep and your mood, how much that shifts and how much that improves. But yeah, it's a great trend. Talk about another good health trend that we're seeing is the non-alcoholic stuff. I think there's actually a bar here downtown that's non-alcoholic bar. They make mocktails.
Oh, really?
I've heard of it.
Oh,
I'm
funny.
sure they're just loaded with sugar. That's a whole other problem right now. We don't want to just start drinking like drinks that are loaded with sugars or dyes. But yeah, there's a whole bar that's a mocktail bar. I love that.
Funny.
It's so cool.
I do want to say that I don't know if you've ever been to Expo West in Anaheim.
No.
It's the Natural Products Expo. It is the coolest thing. It's like my Christmas and New Year's and birthday all wrapped into one. It's so great. And
Expo West.
Expo West.
Okay.
West. And you have to be a medical provider or someone.
okay.
You have to have something or a business. It's not open to the public, but it's companies. So it's supplement companies, it's food companies. It's just expo hall after expo hall of sampling all of this stuff. You would be in heaven. I'm in heaven. And I'm there for, typically 3 years or 3 days. I'm not going this year. I'm really bummed about it. It stopped. I didn't go in COVID because they canceled it.
Yeah.
But you get to try everything, and it's all natural.
So cool.
All cool stuff.
So cool.
But I remember if I went 2 years ago and last year, but the trend was all these mocktail companies where it tastes probably like your gin and tonic that you would drink. But I'm always then, of course, the sugar. So all these things.
Be careful, yeah.
You be careful in everything. But if you ever have the opportunity to go, I'll give you more information on it. It's,
email me more info. I'd love to hear about that.
It's
sure our practitioners would be too.
insane.
Cool.
Yeah.
So
For
cool.
you, first of all, thank you.
Oh, thank you
so much for having this conversation with us, for coming on, for just sharing so much incredible knowledge. I appreciate it. We both appreciate it. Everyone will appreciate
It's an
it.
honor to me. Like this, I could stop seeing clients and just have these conversations the rest of my life and be so pumped about my career.
And these conversations are what are game changer because
people need to hear it.
Who would have ever known before podcasting became as big as it is now?
That's
I mean, no one ever really thinks about it. You can scroll past anything on the internet, but when you're hearing people talk about it and just all of the experience that they have. So please share how everyone can how they can follow you. And I'll put all of your contacts, your website and everything in the show notes.
Yeah.
But if you just want to share like your handles.
FunMed Institute, I think we also have, we kind of rebranded. So funmedidaho.com is our website. And we have three layers of care to what we offer in our clinic. There's primary care that is just kind of, my husband calls it like functional medicine light. So it's like primary care with a functional twist. And that's just, all insurance based. We've got wonderful PCPs that can do all your preventative care. And we love that because then we get to keep the primary care in-house. So we're not sending you back to your PCP and they're questioning everything we're doing on the functional medicine side, right? And we have another tier that's more of our deep dive functional medicine, right? So that we bill insurance in that world, but there's like a very nominal fee to get the functional medicine, and those providers are limited in how many clients they see per day. And then you get certain discounts on functional medicine testing or supplements. And then we have the third tier, and that's where I exist. And that's more of our specialty care, where we do, the fancy bioidentical hormone replacement, the peptide therapies, the really deep dives, the autoimmune advanced detox type stuff. So that's kind of how we exist within Functional Medicine Institute. And yeah, we've got a podcast that you guys mentioned. We've got a couple different Instagram pages where we share clips from our podcast or different events going on within our clinic. We do some really cool, we do multiple events a month where we do, we have a Renew and Reset where we do kind of a whole 30 on steroids type approach for people like you, autoimmune disease, or people that just need those metabolic resets. And we do a lot of educational events and some cool stuff in the community. So yeah, check us out.
Thank you.
Yeah, it's fun.
Thank you so much.
you.
Amber
Yeah.
Warren,
Yes,
thank you for being here.
Yeah, thank you.
And have a good day to everybody.
Thank you, ladies.
Thank you.